Hi, my name is Blake Smith, and this is my presentation for the Capstone project at Herzing University. For my project, I focused on a standardized nurse-to-nurse report in the hospital. Communication is an integral part of healthcare. There is communication between all medical professional practices, family members, and patients that can involve in-depth and sensitive information. This information can be crucial to the patient's care throughout the hospitalization. There are many situations we cannot control, and in these interactions, we can make information prone to being missed or misunderstood. To make the transitions more easily understood and streamlined, the nursing report is one aspect that can be standardized and consistent to make for smooth, complete, and improved transfer of information. Nurses have the obligation to care for the patient during their shift, but the transfer of care can often leave out info pertinent to the best care for the patient. It can prevent errors in how we care for patients, but also can save nursing time and resources by streamlining the cares that are most important to the patient. Patient's care often relies on the right information being passed on to complete tasks in a timely manner. Oftentimes, one or more missed piece of information can lead to delays, improper treatment, or worse, harm to the patient. In the plan for the change, this change would mostly be geared towards the transfers of patients and giving report to floors that are not your own. It would be a transition that would be implemented to every unit, but I would start with using it for transfer situations. I would propose creating a report sheet that would be used by all floors and units on a daily basis. It wouldn't be required for shift-to-shift use, but strongly suggested to make this report a habit. It would, however, be expected method of handing off to another caregiver outside your unit. It would cover all the standard history, diagnosis, head-to-toe information, and in addition, it would include why the patient is being transferred, how they will be transferred, who is transferring the patient, and if the orders are written and by which physician, acceptable time of arrival, and what the goal of the transfer is. Is it an escalation or de-escalation of care, or is there some other purpose for the transfer, like a procedure or test? These changes in the research I've done have been supported by the literature. Taylor from the Clinical Journal of Oncology says, there are many articles, it said that it was found by the Joint Commission that communication errors have been among the top 3 leading root causes of reported sentinel events every year since 2004. And there are many other articles to support changing to a standardized report process. But the nursing profession is an individualized process from nurse to nurse. Given how reliant nursing jobs are on direct or indirect interpersonal skills between patient and nurse, there is any number of ways to complete the job. That being said, it's hard to get nurses to do anything uniformly. Compliance with standardization is one of the barriers to implementing standardized handoff report that is consistent and accurate. Changing a system that a nurse may have been using for the past 35 years is an obstacle that can be difficult to convince a nurse there is a better way. These experienced members of the team are the nurses that are most important to bring on board with the new program and share their knowledge and catch problems with the new system. I completed the SWOT analysis. I've identified some strengths, weaknesses, opportunities, and threats. Here are some examples. One of the examples of strengths is older nurses. Like I said above, they need to be brought on board. They can be a challenge, but also can be one of the biggest strengths in implementing a new change. Experienced nurses that have been in the field for a while and have seen a lot of changes. They can help with the project if they're on board and identify problems before they even happen from past experiences. They also have a wealth of knowledge that could help create and establish a new report system. Some weaknesses that could be interpreted are if the nursing report is not properly conducted to include all the information. If we standardize and don't include all the information that all the floors need, it would be considered a weakness. One of the opportunities is that I work at a hospital as a part of a larger group of hospitals. Implementing a new process at my hospital could be an opportunity to try out a new system. Being a sample size for other hospitals in the organization can be framed as a benefit of trialing standardized charting at my hospital. There is an opportunity to fund this with the intention of a higher good of the larger health system as a whole. One threat to implementing standardized nursing report is the unionized staffing nursing staff. At my hospital, there can be union conflicts that can cause fluctuations in nursing's relationship with management. Within the next year, there will be negotiations taking place between the hospitals and the unionized nursing staff. Last year, when these negotiations took place at another hospital system in the area, there was a strike and nursing staff was out of the hospital for 42 days. Implementing a new policy during a tumultuous time in the hospital can lead to not only pushback to try something new, but also flat-out dismissal by nurses of anything proposed by management. To implement this, you'd have to use the right leadership nursing style. It can be crucial in the implementation of the change. I believe the engaging nursing leadership style would be effective in utilizing a more flattened hierarchical model, thereby engaging and empowering nurses to be part of the implementation and fostering nurse-to-nurse communication. Without nursing support, even a strong leader will fail. The change also has to be implemented in the right manner. I believe Lippitt's change theory is an approach that can be utilized to promote the standardized nurse-to-nurse report. With its 7 concise steps to implement change, it is the theory that works well for making changes in this situation. The following steps to the theory: diagnose the problem, assess the motivation and capacity for change, assess the resources and motivation for the change agent, choose progressive change objects, the role of the change agents should be selected, maintain the change, and gradually terminate from helping the relationship would be a good way to implement this change. In conclusion, the standardized nursing report could decrease communication errors and improve patient care at my hospital. The changes could be significant to reduce errors and improve patient outcomes. The implementation, timing, and leadership would be crucial for the universal adaptation of nursing staff. This year would be particularly poor timing to implement due to the contract negotiations in the upcoming months, and an already demanding learning curve for technology and executive changes. Pending a union strike, the plan to roll out standardized nursing report could be implemented as early as this summer. The process would require planning and benefit from a strong union representative charged to help with solidarity perception. Overall, structuring handoff report between nurses would help the flow of patient care and ultimately improve patient outcome and nurse satisfaction. Here are my references used for the presentation. Thank you for your time.